Now that we have logged into the Bahamas National Patient Portal, or BNPP, we can start collecting data. And to do this, we would have to go to the Patient Portal side panel. Again, if you are on a tablet or a mobile phone, you will not automatically see this side panel. You will have to click on the three dots at the top center of your screen that is closest to your name. Once this side panel appears, you will click on CNCD. This will prompt a drop-down where you will see the three forms that you use: registry, CHAS, and wellness. We'll begin with the registry form. Click on Registry. Once selected, you will be taken to the CNCD Registry dashboard, and to the right of that dashboard, you will select New Form. Once selected, a new form will appear, and you will be on the default Personal page. Note that there are several areas on this dashboard. So we have Personal, Medical, Medical Continued, Blood Work, Measurements, and History. All of these areas are required to be filled in. Moving down the page, we have our section where we can put in our information, and note that there are fields that have asterisks next to them. All fields with asterisks next to them are required. Down at the bottom to the left, we have the Go Back button, and we'll look at that shortly. We have the Save and Exit button to the right, and this Save and Exit button allows you to save the data that you've put in and then to exit the page, so that if you have to leave to go and take care of other business, you can return with the data saved and carry on in your data collection. And next to that, we have the Next button, which will move us forward in the platform. And also, we must select Next to save our information. And it is also recommended that we select Next first to save our data before hitting the Go Back button. Now on this form, we begin with the KEEN number and clinic registration number. And both of these are not required fields, but you can put them in if you have them. Your clinic, however, is required because there's a red asterisk there. And so we will click in the box and select our clinic. Note that once the clinic is selected, the island is auto-populated, and then we can move down and put in the patient personal information. First name is required, middle name is not required, last name is required. Then we have to put in the patient's date of birth, and that is required. If you are on a laptop or a desktop, you can free text the information in, or you can use the calendar icon to toggle between the months and years by using the up or down arrows. If you are on a tablet or a mobile phone, once you click in the date of birth box, another box will appear. To the right side, or rather the left side of that box, is a blue banner, and it has the day, it has the month, and then right on top, there is the year. You are to select the year. Once you click on the year, another box will appear with all of the years that you can scroll up or down to select. Once the year is selected, you can toggle between the months by selecting the left and right arrows, and you can also select the date. After that, you can select Set at the end of that box, or at the bottom of that box rather, and it will insert the date of birth for you. I will free text this date of birth, and then I will select the sex of the patient, which in this instance is female, and then I will select Next. Now we are moved to the Medical tab, and on this tab, we must first indicate if the patient is diabetic. That is required. If we select yes, then more areas appear. Some are required, some are not for us to fill in. I will select no. We also can indicate the date of recent dilated eye exam, but this is not required. Or we can also indicate the date of recent dental exam, but this is also not required. However, the condition of eyes is required, and so when we select that box, we can choose from these options, and I will select normal vision. Scrolling down, I will then select next. Once next is selected, my data is saved, and now I am continuing with the medical information. The depression screening comes next, and that is not mandatory. The statin therapy is here as well. This is a required field, and so I must indicate if any of this therapy is being given or taken. If I select yes, note that I must indicate the medications that are taken for this type of therapy. And if there is more than one medication, I must separate the medications with a comma. If this is not applicable, I can select not applicable or no. Next, there is the hypertension field. Again, if my patient is hypertensive, I will select yes and fill out all of the required fields. In this instance, I will select one of the medications. I do not have the information of the date of first diagnosed, and since that is not a required field, that is fine. But if you have that information, feel free to put it in. And then we have the asthma section, and in like manner, if I select yes, more options appear, and I can filter out and put in the information. But here I will select no, and then I will select next. Now, before I fill out the blood work section, let's take a look at this go back button. So when I select go back, note that all of the information that I previously put in is saved because I had clicked next. I will select go back again. And once again, all of the information is saved that I put in. And I will select go back one more time and note that all of the information is there. Let's now utilize the next button to see if we move forward now, the same information will appear. So I select next, and yes, my information is there. Next again, and yes, my information still remains. And so the next button must be selected first before we go back and before we move forward in order for our information to save. Now on this blood work section, all of the areas here are required. So we will go in and we will select the date of most recent clinic visit. I will use my calendar here just to move swiftly. Date of recent blood pressure screening or reading. Select my date. Systolic blood pressure. You can use the up or down arrow to put in the amount or the value here, 120/80. Then I select next. Now we come to the measurements page. And on the measurements page now, we have several areas that we can fill in. Now, I am only going to fill in the first 3 for this training purposes, but you are the subject matter experts, and so you will be able to fill this in not only quickly, but with the correct data as well. Also take note of this blue banner that says, for any screening that is not applicable, please leave the date field blank. So if it is not applicable, please do not put in a date. So let's start with our glucometer reading. I will put that date in, put the results, and I am using random numbers. And so we see over here that the day since the last test is auto-populated from the date and the results. Then we have the weight. I will choose the date. I will put in the results. And then we have our days since populated as well. Body mass index, I will choose another date just so that you can see that the days are auto-populating. And I will put in a figure here. And notice here we have a different set of days since the last test than the first two. The first two have the same date. The last one, the third one, is from July. Okay? And so we will not fill in all of the other fields, but you are free to do so when you come into the QA or test environment to practice. Now that we've completed this section, we select Next. And this brings us to our final tab, which is History. Under History, we have the recent diagnostic studies. And if we referred our patient to a dietitian, we would click in the box and select yes or no. I will select no. Under the vaccination section, okay, the only vaccine that is required is the COVID-19 vaccine. So we must provide that information, and our patient in this instance is unvaccinated. Then the pneumovax and influenza vaccines, they are not required fields, but if you have that information, you can put that in. The history field is required. All of these fields are required. So we must put in information, smoking in history, non-smoker, alcohol once per week, exercise history, we'll say not documented, patient education documented, nutritional status not documented, number of visits to the clinic in a year, we'll say this person has been there 5 times, and then we must indicate the status of our patient. And so by clicking in the box, we can indicate if the patient is active or deactivated, and I will select active here. Before we select submit, we should make sure that our information is correct. So we can do this by using the go back button and going through all of the fields to ensure that we have the correct data. Or we can do save and exit, where we can save it, come back to it, check it before we hit submit. Note that at this time of this tutorial, editing the form is not allowed. So you must ensure that the data is correct. So let's hit submit. And now we have this green success button that comes up, and we select OK. And now that takes us back to the CNCD registry dashboard. Thank you once again for your attention, and I hope that this tutorial was helpful. See you in the next one.